Welcome to Module 9, the nervousness and anxiety disorders. We will look at the different types of disorders in this module. Disorders that cause nervousness and anxiety could include things like hyperthyroidism, as in too much thyroid hormone, which is responsible for metabolism. So that would make it too much energy, too much nervousness, and lead to anxiety. Another one is pheochromocytoma. Pheochromocytoma will have a little tumor of the adrenal gland, and that little tumor of the adrenal gland will make it too much stress hormone in the body, and too much stress hormone in the body will make you very nervous and cause anxiety. Those are pathological things that can happen. The anxiety disorders themselves go into different categories. We have a generalized anxiety disorder, which is for a certain period of time, a lot of things wrong. We'll look at that. We'll look at obsessive compulsive disorder, and these are disorder that things have to be in order and repetitive movements and things like that. We'll see that. Panic disorder causes you to panic and freak out, as it were. Post-traumatic stress disorder, usually some kind of serious event that happened at some point, and now it is difficult to not relive it. And then the social anxiety disorder, which is what you have when you don't want to get up in front of the room and present your case studies. Moving on, let's look at the thyroid hormone. These are T3 and T4. As far as their chemical structures, what do you care about that? I am not sure, but what we want to know is, what does it do? It increases the metabolism. An increase in metabolism would make things go very, very fast. Okay? That's what it says right there, but I wrote over it. Okay? Hyperthyroid pathologies, as in having too much thyroid, that is a problem. It could affect many, many places. Okay? It could affect the heart. So you have a heart problem. You have a brain problem. That's a really bad looking brain, but there it is. You have a GI problem. This is my stomach. Again, really bad, but there it is. We have a musculoskeletal system. That's my muscle. Might as well put it on an arm. That's a really bad arm, but he's what a mittens apparently. We have a derm. I don't know how to draw skin, so it's just some dude's face. Okay. And genital urinary, and I'm not going to draw that. Okay. Hyperthyroid pathologies. Tachycardia at rest. Too fast heart rate. Okay. Because if you have too much thyroid, and thyroid controls, remember, metabolism, it's also speeding up the heart when you're not supposed to. You're resting. You should not be having a fast heart rate. So that also increases the cardiac output, which is how much blood comes out of the heart every minute, based on how fast that heart is going and how much blood it is kicking out each time. Okay? What will that cause? Well, if your heart is racing, you will be more nervous. You will not be able to sleep, insomnia. You will have little tremors if it's really bad enough, or shakiness. And you will be emotionally liable, as in you will freak out a lot. Increased bowel movements. That means that you'll go to the bathroom really, really lots, including the dreaded diarrhea. Oh, look at this. If you're going to be having too much thyroid hormone, it also makes your muscles weak. And because it makes your muscles weak, you atrophy as you break down your muscles. Okay? And that will cause more tremors or shakiness. Okay? Another sign and symptom of hyperthyroidism is that you will have warm skin and moist. Warm and moist because you have basically sweating and you're just too hyper. Okay? If you happen to be a girl, you might have light or absent menstrual periods. And of course you have your metabolism increase, so that will also increase your urine output too. Okay, what do we know about the primary, secondary, and tertiary? Sorry, it's hard for me to say. Hyperthyroidism. Well, if it's a primary problem, then that means that the problem is in the actual organ itself that makes the thyroid hormone. Okay, so this is the thyroid hormone down here. So if you have a problem with the primary organ, then T3 and T4 are going to be increased, aren't they? They're going to have too many problems because that's where your thyroid is. And the thyroid is the primary organ. Okay? Secondary organ. You're going to have which one of these increased and which one's decreased. Because the secondary organ, if the primary is the thyroid, and I'm making little thyroid hormone things, then the secondary is a little pituitary gland that is in the base of the head, and then the tertiary over here would be the hypothalamus, and I don't really know how to draw that other than some little thing in the brain. And just my little brain. Hypothalamus. Okay? Okay, so tertiary, hypothalamus, secondary, pituitary, primary, thyroid hormone in the thyroid. Okay, so let's see what happens. If our thyroid is messed up, of course our T3 and T4 that comes out of the thyroid will be messed up, and it will be the one that is increased a lot because we're making too much of it. That's what we're talking about in the first place, right? Hyperthyroidism. Well, that's going to put a lot of T3 and T4 inside your bloodstream, right? So if you have a lot of T3 and T4 inside your bloodstream, then the tertiary organ or the hypothalamus, it's going to fill that bloodstream, and it's going to say there's too much T3 and T4 inside the bloodstream, and it's going to say you need to stop that, stop it. So it's not going to release very much TRH because it does not need any more thyroid hormone in the blood. So it will say stop it. So it's going to go down. The same thing with that. If the pituitary gets that signal to say stop it from the hypothalamus, it's not going to want to release any more TSH either, is it? No, because there's no point, because you already have plenty of T3 and T4 in the blood. So it's going to say stop it too. So you got stop it, and stop it. Does that make sense? Okay, secondary. Now the pituitary is no longer the the thyroid is no longer the problem. So in secondary, it's going to start with the pituitary gland. Okay, and that's the problem. In secondary hyperthyroidism, the pituitary is the problem. So if the pituitary is making too much thyroid stimulating hormone, then what's that going to do? Well, you're going to put a lot of thyroid stimulating hormone in the blood, and that thyroid stimulating hormone is going to say, hey, you and the thyroid, do you need to make more or you need to make less? It's going to say, well, you have to make more because I got lots of this stuff that makes this stuff, right? So this tells him to make more. So if you are telling him to make more, then you have to make more too. So that's going to take your thyroids and make them increase, and now you get more T3 and T4 in the blood. Okay? Well, the T3 and T4 in the blood still got to get back to the hypothalamus, and the hypothalamus and say, hey, you got too much. I need to decrease my TRH so that you will stop it. Okay? But he won't stop it, will he? Because he's the problem right there. In the pituitary gland is the problem in the first place because it's secondary. Now let's look at tertiary. Now the problem in tertiary is way up here in the hypothalamus. Well, if I have a problem in the hypothalamus, I increase my TRH quite a bit, don't I? And that's the whole problem. So now my tertiary organ is saying, hey, we get lots of TRH. Who wants it? So he's going to send a message down to the pituitary, and the pituitary is going to say, well, thank you very much. I like that, so I am going to increase my TSH too, because you had TRH, now I have more TSH. Thank you very much. Let's go tell the thyroid that he needs something. What he needs is more T3 and T4. So now everybody says, hey, we need lots and lots and lots and lots and lots. Because it all started with the hypothalamus is the problem, and it went and sent the signal, which sent the signal, and everybody has too much, and that is a problem. Now we have too much of everything. Let's talk about Graves' disease, because that's what we kind of talking about here, aren't we? We have too much thyroid, as in we have too much thyroid with its toxic, thyrotoxicosis. That is autoimmune, not artificial intelligence. So autoimmune hyperthyroidism, too much thyroid hormone. Okay, what is the problem here? Well, this is a thyroid stimulating hormone antibody. Okay, so now we have an antibody that stimulates the thyroid itself. And if it's going to do that, it activates the thyroid and makes more T3 and more T4, and that's what is in the blood, right? Too much T3, too much T4, because of the antibody stimulates the T3 and T4 in the thyroid glands. Now, it is less than 1% in the United States population, which is good, but it is most common in women because it is an autoimmune, and it usually works that way, does it not? Typical age range, that is not good. That is also typical of autoimmune diseases, isn't it? In between the prime of their life, in between 20 and 40 for females, is the age that normally gets hit. So now they have all this thyroid hormone, but they might not be upset because it has to do with metabolism, right? Well, if they really, really want a fast metabolism, they're going to be skinny women, and maybe they'll be happy about that. Except for the problem here, they don't going to be happy with these big bug eyes, are they? No, I don't think so. Okay, signs and symptoms of hyperthyroidism, exophthalmos. That is, though, the eyeball thing that we were just talking about, right? The problem with exophthalmos is you get the big old swelling in the eyes, and even when you go ahead and you treat it, you still keep the big swelling in the eyes. That's permanent. Okay? People with Graves' disease, you get that exophthalmos 5 times more likely if you smoke. So do not smoke if you have Graves' disease. Pretibial myxedema, we have some pictures of that coming up soon, but that is basically where you get this funny little rash and swelling in the legs, in the tibia part, in the pretibia part. Okay? And then you can get reddening and thickening of skin on your shins along with it. And of course there's a goiter. Did you notice the big fat neck right here? That's a goiter, where your thyroid just gets swollen up. You can test, of course, by thyroid stimulating hormone and T3 and T4, just like we saw in the chart before. Meds? Well, and of course you also can find the antibody too for your testing. Meds to stop and reduce production of thyroid hormones. Well, a very good one that will do that is PTU, or propylthiouracil. Propylthiouracil, or PTU for short, because it's a long name, is very, very effective in stopping and reducing these thyroid hormones, the T3 and T4, except that sometimes it's too good, and it makes too much of a problem, and it could destroy your thyroid. The same with radioactive iodine treatment. You can go ahead and do that and treat the thyroid with radioactiveness, but it may destroy your thyroid permanently. So now you have to take T3 and T4 the rest of your life. Just like thyroid removal, duh. Of course that will hurt. Yoga, I don't know about yoga. Yoga might work. Some people say that yoga will help because you can calm yourself down. Why, that's a very ugly goiter, isn't it? You can see the big old fat goiter here. That should not be there. The same with her. She has this big old goiter right here in the neck. Makes for a very expensive necklace to go around because it's really big. Okay. So that's a lot of hypothyroid cases. They mostly have that big old enlarged thyroid gland, which we call a goiter, right? They put this little thing over her eyes so that we would not recognize her in case she was our grandmother. Okay, more stuff about Graves' disease. Common cause of hyperthyroidism, again it's less than 1% in the United States, but overproducing thyroid hormone, too much thyroid hormone. And that can cause the goiter, and it can cause the bug eyes or the exophthalmos. They say heat intolerance is another thing, which means since your metabolism is going so fast, you can't take any more heat. You already have plenty of heat, so you don't want any more heat. So you cannot tolerate it. And anxiety, yes, it makes you very nervous because everything is going faster, including your heart rate. And that makes you very nervous. Okay, normal. The blue one's enlarged. Nothing there. And there's your big bug eyes with Graves. Exophthalmos. There's another guy. He looks really creepy, doesn't he now? Maybe we should give him some red eyes and make him look really scary. Really, really scary. Ooh, he's like a demon guy. Ooh, that's really bad, isn't it? He's demon man now with exophthalmos. We should not make fun of sick people. What's wrong with you, man? Well, that didn't look right. Somehow his eyes are in the wrong place now. Oh, look at those legs. You can't really tell, but there is all sorts of edema running around all over the place. Can you see how swollen that up? That is really, really, really swollen from this part up. And you have little rashes all over the place, but you can't really tell too good from this picture, can you? Pre-tibial mixed edema. Lots of edema. Other pictures of it might be a little better. Alright? Ooh, can you see that red rash right here? Pretty nasty little red rash. And you can have some edema in here. And lots of little spots everywhere. And this is very, very, very dry skin. Well, what happens if you have your thyrotoxic state that is too toxic? Well, it's called a storm, a thyroid crisis or thyrotoxic storm. That is bad because now you have really, really, really high T3 and T4, so much so that you are going many millions of miles fast. Everything is going really fast and you can die. Yep, you can die in 2 days. 2 days without treatment. 2 days without treatment. Well, what causes it? Well, usually you have Graves' disease and maybe you are not having it diagnosed. You think, oh my goodness, I am a 25-year-old woman and I'm very skinny. I can eat whatever I want and I have all this energy and I'm very, very happy. But then all of a sudden it decides to kick in too high, spontaneous or without any kind of warning. Maybe because you got an infection or maybe because, you know, Jimmy likes Becky and you like Jimmy and you get all emotionally distressed. And now we have a problem. Now we have a storm. And that increased stuff, that increased thyroid hormone can get so bad it could kill you. And then Jimmy's going to get W anyway. That's very sad. Hyperthermia. Ooh, that means too hot, right? Hot, hot, hot. That would make sense with your metabolism increased. Tachycardia. Ooh, that's too much, too fast hot. Much too fast hot. And that says in the atria part you could have a tachy, these rhythmias, as in too fast, not good, rhythms in the atria. That could be bad because you can't pump blood anymore. And delirium. Oh, you get delirium because you get too up. Everything is too up, and your brain does not really work as well, because now you have too hot and too fast heart, and it will cause your brain to be suffering. Okay. Nausea and vomiting, of course. Nausea and vomiting because everything is going so fast and it's just way too much for you to handle. And then the diarrhea, that can cause dehydration. You can run yourself out of water with diarrhea. Okay, so you have to treat it now with PTU, because now PTU, even though it is very, very powerful drug, it will stop the thyroid hormone, and it will stop it pretty fast. Kind of related to the same kind of thing is a toxic nodular goiter. It is toxic, just like this storm. It is a nodular goiter, as in the little nodes, like a little goiters nodes. Okay, so if you look at this, you have these little nodules, a little nodule or a bump on top of the thyroid, and that thing can produce way, way too much stuff. Okay, so you get this thyroid nodule. It could be benign or it could go malignant. And this is pretty common, so it's the second most common cause of hyperthyroidism after Graves. 15 to 30% of U.S. cases are from the toxic nodular goiter. Greater than 60, well, that's an older female, is it not? You never see it in children, though. So usually over 60 years old in females, they get the toxic nodular goiter. Okay? Well, what started it in the first place, I don't know. Maybe you didn't have enough iodine in the first place. So all of a sudden you try to way overcompensate for not having enough iodine. Maybe you didn't get enough salt or something, and you way overcompensate, and now your little goiter, the little nodule, grows right there and says, I need to start producing really, 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 really fast. Okay? So maybe you injected that iodine, and all of a sudden you said, whoa, now I'm taking all of it, all of the iodine, and I'm going to use it right now, and I'm going to go crazy with it because I didn't have any before. Signs and symptoms of hyperthyroidism. Well, do you get that? Well, in this case, it is so fast that it happens at the toxic nodular goiter. You don't even have time to have the exophthalmos or the pretibial myxedema. Okay? So you would still have the increased everything else, right? The increased heart rate and the sweating and the diarrhea and all sorts of stuff like that, but you're not going to have the pretibial myxedema and the exophthalmos and the toxic nodular goiter. So we want to test. We want to say, hey, we got lots of T3 and T4. Where is it coming from? And then we can look at TSH, and if TSH is saying it's not me because I'm telling him to calm down, well then it must be something in the thyroid, and maybe we can find a little nodule. Maybe we can feel it, as in palpate. We can feel it with our fingers. Or maybe you do an ultrasound, and then you can see it with the ultrasound. Oops, that went the wrong way. I didn't mean to do that. And of course you can do an iodine scan to find your hot or cold nodule. We'll look at next time on the next slide right there. And of course biopsy it to find out what is going on in there. Okay, now we have our hot nodule and cold nodule. In a hot nodule, that means you are taking too much radioactive iodine up. Okay, so that means you are very, very, very active. Okay, and it doesn't matter about the TSH actually, because now you're working all by yourself. Okay, so if you look at that back slide, the one before, where I said that you would have less TSH, actually it does not matter in this, because it's the little nodule that is doing it, and it could care less how much TSH you have. The cold nodule right here, in the cold nodule you don't get a concentration of radioactive iodine. Okay, and there is a chance, by the way, of thyroid cancer when you have these nodules. So it says it's not a huge chance, but it's a 10 to 15% chance that you can get thyroid cancer from these nodules that are going to be making too much thyroid hormone and sucking up iodine. Let us cut off right there because we don't want this video to get too long. we will pick up next time with a few cromosatoma.